Hi, Constantly.
Hello, everyone. How are you? How are you, Listra? Thank you so much for coming up tonight. And I just want to welcome the rest of the world of people who are watching us. And I just want to say welcome again to our weekly video. We post a video here every single week. We talk about different things in terms of how we deal with our mental health and how we deal with our health condition that stay with us and we have to live with them for longer term. So last time when I was with the Listra, we spoke about SCA3 and she explained more about it. But tonight or today, we're going to talk about how does really Listra manage this SCA3 and how does that impact on your mental health. Listra, please, let's hear from you how you actually manage to deal with living with the SCA3.
Okay. Well, hello, everybody, and welcome to our little show. Okay, so how I manage my mental state with SCA3? Well, first of all, I have to accept that I have the condition because it is a genetic condition, and I usually say the prayer, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So first of all, it's like knowing the things that I can change about myself and knowing the things I cannot change. So the things I can change are the way that I respond to the diagnosis, things about my thinking pattern, and I can only change my response to the whole thing. So what I do physically in the morning, although physical, we have to look at this holistically because the mental health is not separate from the other parts of our personalities.
Very
It's a
true.
holistic thing. So physically, in the morning, I do some stretches, do some deep breathing, and get myself into a groove, because otherwise I could get things like joint pain and things like that, which can be quite uncomfortable. So I have to do some stretches and some exercises, activities throughout the day. Sometimes I go on the ball and do some balance exercises. Then I have to do something called mindfulness, which is a type of meditation where you concentrate on the present. Because walking down the stairs, I have to concentrate on the present. Because when you have SCA3, it is difficult to multitask. So you have to do one thing and concentrate on one thing at a time. So if you're eating, you have to eat. If you're drinking, you have to drink. If you have to do, because one thing, what I notice is that if I'm drinking something and I'm thinking about something else, then the drink might go down on the wrong side, and I start to asphyxiate, can't breathe properly. And that happened yesterday. So,
Listra, if I can ask you one question, how did you actually manage for someone who has been being multitasking, doing one thing when you're doing another or at the same time? How did you actually manage to have that mindfulness of focusing on only one thing and knowing that you can't do another thing at the same time? Like you can't do two things at the same time. How did you manage to train yourself to become where you are at the moment?
Well, it's a necessity, because when you have this condition, it's a matter of life and death, in the fact that it's not as terrible as I'm saying, but if you do not concentrate on one thing that you're doing, you could jeopardize your safety. So it's a matter of having to reflect and do the things that you slow down a bit. Because when I could have done multitask, I used to do 100 things at the same time. But it has helped me to focus and to slow down on things considerably. So I have to focus on one thing at a time.
And how does that make you feel, knowing that you actually have to focus on only one thing at a time? How mentally, how does that make you feel?
Okay, well, for me, I've grown to accept the fact that I do have this condition, and the first step in dealing with any situation is acceptance. So by accepting, then I can make the changes necessary to adjust myself. And I always say that I'm an adaptable, just adjustable and flexible personality. So in that case, you have to be in order to be able to cope.
Okay. Sorry, I think earlier you mentioned some kind of techniques that you use throughout your day, or a way that you manage to start your day and doing this mindfulness, breathing techniques and stretching. How long does this take you? Is it something you do every single day? And how long does it take you to go through the breathing technique, stretches, and doing mindfulness? How long does it take you every single day?
Right. So it become a lifestyle thing. So it's not like one time of the day for the day you're gonna do it. You're gonna do it as soon as you get up, as soon as you wake up in the morning, which will be about 15 minutes. Then during the day, you will keep doing things to help you. So during the day, I sometimes just go on the ball, think, reflect, do some gratefulness technique as well. Gratefulness helps you to be happy. It helps you to see the things that you have rather than the things that you don't have. And one thing I do as well is this: I crochet. So I'm in the process.
Wow. Let me tell you something. That really reminds me when I was growing up, a little girl, maybe about 8, 10. I used to make those things, and those are really nice. They can be very therapeutic.
Yes, because it helps you concentrate on doing one thing, and you tend to relax.
That's right.
Something positive, and you're able to relax.
Mm.
So I do not always do it, but occasionally I do it, just to help me to keep my mind relaxed and focused.
Wow. That's a very, very helpful, Listra. And I know that it can be very, very difficult, knowing that you have something that you have to deal with throughout your life, and finding the techniques or finding that routine that you have to go throughout. Although it might sound like that difficult as appears or as looks like, but actually some of the things that you mentioned, like breathing techniques, stretching, and and mindfulness. This is something I personally do. As soon as I wake up, I do them. And actually, as you said, the more you keep engaging these things, they become your lifestyle. You feel like you can't actually do without, without starting your day with these things. Because I know that, like, for example, my daughter, when she's, she comes to my bedroom and she will find me stretching, she will find me doing this, or, and she'll be asking, Mommy, why do you have to do that? And I will ask her, just join me, and she will join me. And actually, and these things also helps you like feeling very fresh, feeling very energized throughout the day. So this is really wonderful to hear. Although some of the things we do them, we don't know how actually they can be very helpful for our life. But these are things that helps you, keep going as the day going. So apart from all these things that you mentioned, is there do you have like a therapy you attend, or do you have counseling? What else that keeps you relaxed throughout the day?
Right. Well, I don't have counseling or therapy. However, you see, laughing and smiling, greeting somebody during the day. You have a friend contact list. Send a message or something to somebody and make yourself feel happy as well. Because when you make other people happy, you feel happy. So smile, look in the mirror, laugh at yourself, and you just, even somebody who you haven't spoken with in a long time, you can just call them up and find out how they're doing. And this is my therapy.
Wow, thank you so much. I think you mentioned something about, looking ourselves in the mirror and smile. But I can tell you that as long as, no, unless you have that intention of smiling, most of us, when we check ourselves in the mirror, we don't appreciate how we look. It could be, my hair is not done. It could be my face is not beautiful. It could be my makeup is not done well. It could be anything. So I think it's just about having that intention. What actually are you doing, and what do you want to get out of it? And Listra, do you have anything else to say in terms of how you maintain your mental health before we close?
We are the biggest critics of ourselves. So try not to criticize yourself too much. Try not to be too harsh on yourself. Take it easy, because life is not punishment. So do not punish yourself. Always look to reward yourself. See what you're doing good and pat yourself on your back.
That's exactly that. Because sometimes we are just sitting there waiting for someone else to, come and tell you well done, and you're doing amazing and this kind of things. But actually, the whole appreciation should start with us. The whole happiness we are looking for, it should start with us. Because the rest that is outside of ourselves, it should be additional to what is going on inside of us. So thank you so much, Listra, for today. And next time, I would love us to talk about, you mentioned something to do with acceptance, and this is something really touched me. And most people who have got mental health issues, or people who have some health condition that are going on, and they feel like, they are just on the edge. There is nothing else can be done. And this is something that I would love for us to explore for on our next video, when we're talking about acceptance, and what does actually this acceptance means to us, and how can we further manage how to deal with everything else around us, and also with the all the health condition that most of us have, that we need to have or to live with throughout our life. It may be you having that condition, it may be someone you're looking after. How do you actually manage to look after that person? And how do you manage to cope throughout the day? So thank you so much for everyone who's out there watching. And so in our next video, we will be diving in, talking about acceptance and what acceptance means to you and what does it mean to me. Thank you so much for watching, and we'll see you in our next video. Thank you.
Okay, thank you, everyone.